I interviewed my friend Molly, who has a 2-year-old son named Sean. Molly is Korean and married a Japanese man named Ben. Molly and Ben's son was born on October 18, 2011. About half a year after Sean was born, Molly noticed that he wasn't developing speech. He still needed support to keep his head up and body upright and cried constantly. It was only until around last month that doctors finally diagnosed Sean with autism. Molly expressed to me that at first she felt defeated because she knew that her child would never grow up to live a normal life. However, she did feel a sense of relief because they were able to tell why her son wasn't developing correctly. Autism spectrum disorders are neurologically based disorders that affect individuals primarily in their communication and social interactions with other people. Common characteristics associated with autism are impaired social interactions and relations between the individual with autism and others. A person with autism often demonstrates weaknesses in communication. Asperger's syndrome is considered to be on the high-functioning end of the spectrum. Students with Asperger's usually have a difficult time with social interactions and demonstrate repetitive behavior. Rett syndrome occurs mostly in girls and is rarely seen in boys. Common symptoms are problems with walking, seizures, and intellectual disabilities. Children with childhood disintegrative disorder display a lack of communication skills, non-verbal behaviors, and they have a loss of motor, social, and language communication skills. Pervasive developmental disorder affects both children and adults who are on the autism spectrum but who do not fully meet the criteria. They have social and language development challenges. Autism spectrum disorders vary in the nature and degree of their severity. Autism is the most common condition of autism spectrum disorder. Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive developmental disorder are also other forms of autism spectrum disorder. The cause of autism is developmental brain abnormalities that are genetically influenced. It affects the cerebellum, cerebral cortex, limbic system, corpus callosum, basal ganglia, and brainstem. Research has not supported other causes such as infections, adverse nutrition, and vaccines. According to the Centers for Disease Control and Prevention, 1 in 150 children in the United States have autism. The number of children with autism is rising. Autism can usually be diagnosed starting at 18 months. Young children with autism may not engage in symbolic play, show much imagination, or explore objects. They have difficulties with information processing, acquired knowledge, and verbally mediated skills. Children with autism also have distinct behavioral characteristics. Some of the more serious behaviors are aggression, tantrums, crying, shouting, and self-injury. Children with autism have a need for routine. Following strict routines will settle their need for sameness. People with autism do not interact with others with the degree of emotions that people without a disability typically do. One explanation is the theory of mind. People with autism have a mind blindness. While interviewing my friend, I learned a lot about what she needs to do to meet her family's physical and health needs. On a daily basis, she needs to cook, clean, do laundry, think about transportation and healthcare. Recently, my friend had shared a frustrating period when her husband's insurance company wouldn't cover her son's speech therapy. It is important that when working with families, we as professionals are considerate of the family's schedule and life. Although education may be the most important aspect to us, education is only a portion of the family's life. We can help the quality of a family's life by being efficient with our time. Every family is different, so we need to alter the way we communicate with families to match their wants and needs. We can use set meetings, parent notes, communication logs, or call home to the family. When talking with my friend, I learned a lot of concerns she had for her son. She wants her son to grow up to be independent and have the ability to carry out daily living skills such as washing his hands, tying his shoes, and counting money. Daily living skills can be a part of the child's IFSP or IEP if they are appropriate for the student's strengths, preferences, or needs. As a new older brother, her son can start helping out around the house and start developing some basic skills. The discussion about my friend's concerns about her son also brought up goals that she would like for him to meet in his future. These are goals that her son's future teacher can use to incorporate in her or his IEP. Something else we talked about was her son's future education. Currently, her son is only 2 years old, so he is not enrolled in any kind of education. However, when he is of age, my friend discussed some expectations about what she expects from her son's future teachers. Her main expectation is that she wants the school to communicate and allow her to collaborate with them to benefit her son. She had expressed to me that she knows her son better than anybody. This is an important fact. When teachers talk to family members, oftentimes they give us important information such as the student's strengths, weaknesses, personality, preferences, etc., because they know their child better than anybody. It is also important to discuss and reflect with families before making any decisions about their child. Families should be allowed to give their insight and input. They may know strategies that may work for their son or daughter. I have learned that collaborating and communicating with families can only benefit the child by bringing together multiple perspectives and resources. Instead of just having a teacher's strategies and insights, parents can provide insightful, brilliant methods to working and meeting their child's goals.